Hey, beauties, what's up? Thank you for tuning in to another episode of Let's Ask the Surgeon. My name is Larice, and I am your host, and I am also the founding owner of BeyondBody.com. Today's episode is going to be on compression garments. And so I am about to bring out Dr. Laverson right now so we can ask a couple of questions and clear the air about compression garments. Hi, Dr. Laverson. Thank you
Hi,
for
Larice.
tuning in. How are you doing today?
Wonderful. Always nice to see your smiling face, Larice.
Yes, yes. Thank you for taking the time out of your busy schedule. I
Mm.
know like you're super busy, so I won't keep you long. Okay, so today's topic is about compression garments. So I know through going through the surgery, speaking of tummy tucks, I'm sure it's different for depending on what body parts you're having surgery on. But from my experience, I first went through the ab binder or ab binder or board, and then I went to a faja and then a waist trainer. So the first question that I have for you is, how long should a compression garment be worn?
Okay, well, that's a good question. Everybody wants to know. But there's no one answer, Larice, really. It depends on the kind of surgery and honestly the surgeon's feelings about it. But I have found in general the patients that wear them the longest and are the most attentive to the fit of the garment, the comfort of the garment, all the details, attention to detail, and they wear it for a long time, they're going to get a better result. And I'm going to tell you a little something why I think that is. Um, because those compression garments, they're not new. Back in hundreds of years ago, I mean, women wore these corsets and they'd be specially designed and this and that to get this hourglass shape. Do you know, I really believe that if you know the anatomy, there's 12 ribs, okay, but the bottom two ribs for most patients are called floating ribs. They're
Yes.
floating. They don't go all the way around to the sternum here in front. So they protect the kidneys in the back, but they just sort of end in your muscle and connective tissue. But I have to tell you, they do articulate at the spine, the lateral processes of the lower thoracic vertebrae, T11 and T12, and those are joints there. And if you have a corset, it can actually over time change the angle of those ribs and
Mm.
narrow the waist and lengthen the waist a little. I'm not advocating that, but I'm saying that I do believe that over time that happens um, for patients who wear them for an extended period of time if it's compressing that. So that's why I think it makes a difference. But also, those garments really do help shape. They help shape the body. And again, Larice, we talked about this. The sutures that I use are absorbable stitches. They lose their strength over time, but your body takes a long period of time to heal, to for the collagen scar to cross link and get strength. So while those sutures are gone, they're going away, they're being absorbed, and before your own body's collagen is strong, holding that tummy tuck, holding the shape, it's good to have that external support, and it takes months for your
Mhm.
collagen. This period of what they call fibroplasia, when your collagen is cross-linking, getting strength, takes months. So I like when patients wear it for a long time. I do feel like that the best results I have are patients who are attentive to the garments.
Okay. Okay. Well, since we're talking about the length of wearing it, the next question I want to ask is it true that if you wear the compression garment too long, can it or will it weaken the ab muscles? Because that's floating around the internet and women really want to know.
Um, well, I do say that the if you're using the garment as a substitute for fitness or exercise, then yes, your muscles are going to atrophy, and maybe that garment is supporting you instead of your own core muscles. So, I, Larice, I think there may be some truth to that. I mean, if you're wearing those compression garments, it stands to reason that you're getting external support and you're not using your muscles for core support. So, yeah, I mean that's certainly possible. But I would say, uh, don't give up the exercise, the core fitness. I mean that's critical at some point in your recovery. It's going to be longer after a tummy tuck than after, say, lipo 360 or lipo and fat transfer procedures like that, BBL, because that doesn't really affect the core musculature. The tummy tuck tightens the core musculature. It's not easy to return to core exercises so easily, so quickly. But I think if it's a lipo type procedure, fat transfer, it's going to be quicker. So you won't maybe you'll be able to return to core exercises quicker, and you won't lose that strength, um, and won't have the kind of pain that you have when you return to core exercises. So yeah, I don't know if that answers the question.
Yeah, you did a good job with that. That's true about when you get back to working out the muscles. I'm experiencing that. It's kind of rough, but you just learn not to
Yeah,
push yourself more than, what you can handle. Eventually you'll get there. So
yeah.
the next question that I have is what happens when you don't wear the compression garment or you stop wearing them too soon?
Oh, okay. So listen, Larice, that's a really good question because there's a psychological thing. You get a month, 2 months out of your surgery, you're back on your feet. You got responsibilities, returning to work, um, taking care of the kids, being more independent. So you feel like I don't need this thing anymore. But but I do say this: depending on what pregnancy did to your body, if it stretched out the abdominal wall, so there are two layers. There's the skin and the fat on top, then the abdominal wall. They're both stretched during pregnancy. But if your abdominal wall was stretched and the tummy tuck tightened it, and you stop wearing, and I don't, absorbable or non-absorbable stitches, if you get back maybe to exercise, you're not wearing the garment, you're increasing your abdominal pressure, you could bulge out again because like I said, your collagen, it's not really strong yet. So I do tighten maximally during the surgery. I know women want the flat belly, they want the hourglass shape, they want to restore to what they had before pregnancy, stretched everything out. And that's what I try to do in surgery. And I know my sutures are going to lose their strength after a month or two. So until their own scar gets strong enough, I want that support garment. Um, like I said, the psychology is you don't want to wear it after a couple months, but that's when it's most important because the sutures are gone. So I
Yes.
say, I say it's 4 or 5 months. Do you need it every minute of every day? No, you're not going to stretch out by stopping to wear it for, I don't know, you're going out for the evening, you want to wear a certain dress, you don't want a compression garment, fine. You want to go to the gym, you don't want to wear it, fine. But in general, I like it for months because we don't want to bulge out again. Then what do we do? I've got to, as a surgeon, prevent problems. The best treatment of complications is prevention. Okay, so I don't know. A lot of women may not bulge out after. I'm not saying you're gonna bulge out, but I don't want you to bulge out. So I have to be extra cautious and say, listen, please wear the compression for 5 months. 4 to 6 months until it's really flat. So I ask that patients wear it because I don't want them back in my office with a bulging abdomen and say, look, doctor, you did this tummy tuck. Now look, I've still got a bulging belly.
That makes sense. That makes
Yeah,
sense. Because there are some, I know each surgeon is different, but there are some that they don't even tell their patients to wear compression garments. Like I don't want to say against it, but I don't know, some patients don't wear them.
I know every doctor does it differently. I say, you look at the results, talk to other patients. I mean, I'm not saying my way is the only way, and I'm not saying my way is the right way, but this is just my observation over 30 years of practice. I've operated on professional entertainers, people that are like you, Larice. You're on top of things, and the patients that are really on top of it, they pay attention. I find they end up with the best results. I mean, that's just all. I have plenty of patients who are maybe less attentive and have good results, but I've also unfortunately had patients who come back with a recurrent bulge and they stopped wearing the garment after a couple months. And I don't blame them. I mean, a couple months, you feel like, hey, things should be healed, but they are not. It's just
No.
biology. It's collagen cross-linking, takes place over months, and that's all.
Yeah, it takes time. Healing definitely takes time.
Most people are active these days. They want to do the core exercises. They want to, and that stresses the abdomen, so it may go back.
Right. Okay. Well, our last and final question that I have for you, what's the difference between an ab board, or maybe it's called ab binder, a faja, a waist trainer, and at what stage should each of these be worn?
Well, that's okay. So I don't know the exact definition, but the ab board is sort of a diamond shaped, semi rigid, basically board. It's a device that it helps maintain the belly flat after the tummy tuck, provided there's compression on top of it. And the idea is that compression's soft. If somebody's had maybe lipo in the back or even a BBL, they want that waist shape in the back. They've got this fabric garment in the back that conforms to the shape of the fat transfer and the liposuction. But in the front, you want the belly flat, and there's no bone in the front. There's there's nothing there. So the board is some flat support to help keep the belly flat. And those are marketed. You can find them online. But they're semi-rigid, and you put them underneath the waist trainer or the faja for extra flat support. Okay. Then the fajas, I think I think the original fajas came out of Colombia. Okay. Mm-hmm. And they still make, I think, very high quality garments there. But basically the faja is a body garment that helps. The faja can supplement the surgery in many ways. If the faja goes up to the breast and wraps around, I find they are the best breast support, better than any bra. Those fajas that have the hook and eye closures in the front and go up onto the bottom of the breast, great breast support, pushes the breast up. If the woman's had a breast lift, those are fantastic, and I highly recommend them. And I actually include the price in the surgery because I don't want to lose the result. It's part of the result. I really firmly believe that those garments are part of the result. So I don't want the woman to say, no, it's too expensive. I'm not going to buy this thing. No, I want them to have it because otherwise my result is not as good. So the faja is sort of a body garment. The waist trainer, it's restricted to the waist. The faja, by the way, goes down. Sometimes they go down to the thighs. There's short thighs. Then their long thighs go down to the knees. Sometimes if the procedures involve lipo, the legs, they even go down to the ankles. So you can get a custom faja depending on the procedure you had. And the faja is like if you have fat transfer of the buttocks or the hips, it'll be a low pressure area there. It'll cover the hips, but it won't be pressing real hard because you want that fat to engraft, to get a blood supply. And that's so it applies even pressure but low pressure, okay, over the buttocks and the hips. And so there are different kind of fajas. And then the waist, of course, you're going to have in the back where the fat came from, you'll have some higher pressure, to get the narrow waist. The waist trainer, though, it's just for the waist. If you had just a tummy tuck, the waist trainer. Sometimes, though, I know, Larice, your shape, for example, you have this hourglass shape. If you just get a waist trainer when you sit down, and I don't know exactly your experience, but a lot of women, if they have just a waist trainer, it'll inch its way up because it's wider around the hips. So they're moving around during the day. All of a sudden, they find if it's a fabric device, if it's latex and it's solid, maybe it'll stay in place. But the fabric ones tend to roll up for women that have really broad hips and a narrow waist. It'll roll up and it's like a rubber band around your waist. Now, if you want it all the way down, the waist trainer, sometimes it'll have a crotch or it'll go down to the thighs, you know. So, but the waist trainer, it's designed to basically support the abdomen and narrow the waist.
Okay.
Yeah.
Cool. Well, that's all the questions that I had for you today in regards to compression garments. So thank you so much for your time, Dr. Laverson. Again, I don't take your time for granted. I know it's very, very valuable. You're a busy surgeon and, you know, you're seeing us in between. So thank you so much for that.
Larice, it's always such a pleasure. Thank you for your service and your help getting the good word out.
Yes, absolutely. Take
All
care,
right.
Dr. Laverson.
Thanks very much.
All right. So you heard it from Dr. Laverson. So again, this episode was strictly on compression garments. If you have any questions that you can think of that you want to hear answers to or see on this channel or in these episodes, these next upcoming episodes, please make sure you leave your questions in the comment section and let me know. And, you know, I will be able to bring that topic up on the next episodes of Let's Ask the Surgeon. Take care, beauties.